So good afternoon all. We'll be continuing with the diagnostic procedures. So we have already dealt regarding the blood investigations like cardiac enzymes, then lipid test. Then next we have moved on to Holter monitoring, chest X-ray. Now next we will move on to exercise ECG, which is also called as a stress test. Okay, exercise stress test it is called as. Sometimes it is also called as cardiac stress test. Okay, children, please note down this. This condition is called as cardiac stress test, or it is also referred as exercise stress test. Commonly it is asked as stress test for the exam. So don't think stress test means giving some stress for the some people and then you are monitoring. Okay, so this cardiac stress test is a very important diagnostic procedure. Okay, so it is a most important diagnostic procedure that is done for patients with the coronary artery disease, especially to assess the coronary blood flow or to assess the coronary circulation. Okay, and usually this exercise stress test, it measures the ability of the heart to respond to the stress. Like, you will ask the person to do some exercise and all, and then you are monitoring the person's vital signs like maybe heart rate, blood pressure, and ECG. Okay, so that is done particularly in this exercise stress test or cardiac stress test. It is measuring the ability of the heart to respond to the stresses. Okay, so introduction, it is used to detect and evaluate the ischemic heart disease, as I have told. So ischemic heart diseases are those conditions where there is decreased blood flow to the heart, like your coronary artery disease or atherosclerosis and all, where there is plaque deposition or cholesterol deposition in the coronary arteries. Okay, so mostly it is used to detect all these conditions. Definition of exercise stress test or cardiac stress test is, it is a procedure which is done to measure the ability of the heart to respond to the stress. Okay, it is used to measure the ability of the heart to respond to the stress. And usually in this exercise stress test, what they will do is some procedures are done or some exercises are done, like walking on a treadmill. I'll show you the figure. I think in the first figure already we have seen the treadmill there. Okay, so this is actually a treadmill. Okay, usually in the gyms and all you have got that. Okay, so here the person will maybe asked to walk on a treadmill, or sometimes they may be asked to pedal a stationary bike. Okay, not a bicycle riding one, it is a stationary bicycle. Okay, so when they are pedaling the stationary bicycle or while they are walking on the treadmill, usually they will be measuring the vital signs like heart rate, blood pressure, and ECG. Like, they will compare and they will see the changes in the vital signs, like before the procedure what was the change, during the procedure what happened, and after the procedure what had happened. Okay, so remember, exercise stress test or cardiac stress test means it is a it is measuring the ability of the heart to respond to the stress. Now, purposes or indications, as I told you, most of the time it is done in case of ischemic heart disease, like to diagnose coronary artery diseases or ischemic heart diseases, or most of the time in the case of myocardial infarction, isn't it, the person will be having chest pain and all. So to evaluate further, okay, for that you are performing the exercise stress test. One more reason is to evaluate the exercise tolerance of the client. For example, we want to know the ability of the heart, okay, how much they will respond to the stress. So you are performing the exercise stress test. Like, for example, after the cardiac surgeries or after the myocardial infarction, what happens is the ability of the heart to pump the blood doesn't remain the same. Okay, so they want to find out the changes, what has happened. So we will perform the exercise stress test. Other than that, it is also done to assess the severity and prognosis of CAD. Okay, so if a person is having coronary artery disease, to know the severity of it, we can perform a stress test. Next is, most of the time it is seen that we will do this stress test, or the doctor may advise to do a treadmill test for patients who are with high risk. Okay, like you are expecting that they may be having any cardiac problems like MI or CAD and all. In that case, probably we will go for this test. Okay, stress test. And next is, as I told, it is done to evaluate the ability of the heart to respond to the stress. What are the contraindications? We already saw the indications or purposes. We want to know what are the contraindications. Now there are few important contraindications. In this case, you should not go to perform a stress test procedure. Okay. For example, if a person is having uncontrolled arrhythmias, uncontrolled arrhythmias means arrhythmias refers to abnormal heart rate and heart rhythm. Okay, so if a person's heart rate and heart rhythm is changing rapidly, you cannot perform a stress test because the heart may not be able to cope up with the exercise. Okay, so suddenly they may go into chest pain or they may go into any other complication. So if they have got uncontrolled arrhythmias, you should not perform stress test. Next is if they have got any uncontrolled valve problems. You know the different valves, isn't it? We have got semilunar valves and atrioventricular valves. So any defect in the valves, severe defect in the valves, also you should not perform the stress test because the heart will not be able to cope up with the excess of workload. Next is cardiomegaly. We know that in cardiomegaly there is heart enlargement. So already the heart is enlarged and the heart may not be able to pump more and more blood. They may not be able to work hard while you are performing exercise. Okay, so again patient can go into maybe heart failure or they can get a MI. So you will not perform a the stress test. Next is if they have got angina. Angina is chest pain. Okay, now chest pain which is related to heart, if they have got like severe recent MI was there or recent heart attack was there, in those patients also you will not perform the stress test. Okay, because suddenly they may develop anginal attack. Okay, next is uncontrolled hypertension. Maybe if their BP is very high, not able to control, in those patients also you should not go for cardiac stress test. Or otherwise if the person is having inflammatory diseases of the heart like your endocarditis, myocarditis or pericarditis, in those cases also you will not perform the stress test. So this is a example of a treadmill. Okay, you can see that here they are tying the BP cuff also. Electrodes are also there. Why they are attach the electrodes to the chest? Most of the time to monitor the ECG. Okay, and then the person will be made to walk on the treadmill and they will monitor ECG, BP, heart rate, everything. Okay, so that is referred as one of the methods of cardiac stress test. Okay. Now next is moving on to the nurse's responsibility. What and all they have to do. I'll tell you what is the exact procedure also in the coming slides. So before that we will see what is the nurse's responsibility. So first of all the main responsibility is monitoring the vital signs. Okay, so before the procedure they have to monitor vital signs. During the procedure also entirely they'll be monitoring vital signs, and after the procedure also they are monitoring the vital signs. Okay. So remember, monitoring vital signs here will include monitoring the BP, ECG of the patient, heart rate of the patient as well. Okay. Why you are monitoring the patient's vital signs continuously is because there can be some ischemic changes or patient can suddenly develop with chest pain or any other reaction. Okay. Next is um, when the person is performing the exercise, maybe they are asked to walk in a treadmill or asked to walk on a stationary bicycle. See the ability of the person to do the exercise. If they are developing chest pain or if they are developing any dyspnea, shortness of breath, palpitations, immediately you have to stop the procedure. Next is tell the patient that before the procedure, that is prior only, you have to advise them to wear comfortable and loose clothes and come. What happens if you wear a tight jeans and come? Already you will be feeling constricted and you will not be able to perform the exercise also. Okay, so tell the patient to wear loose clothings and also wear a comfortable shoes and come while they are walking on the treadmill and all. Okay, or while they are pedaling on the stationary bicycle. Okay, next is tell the patient to inform immediately when they are experiencing any type of signs and symptoms. Now commonly, as I told, here we are making the person to walk on a treadmill or to like pedal the stationary bicycle. So what happens is the patient can develop suddenly dyspnea, shortness of breath or palpitations, chest pain, whatever they develop. You have to tell them to inform immediately. They should not wait. Okay, next is some other this one nurse's responsibility is there. That is always the nurse has to monitor the person. Okay, like excess of sweating is there or they are telling that they are not able to walk or run on the treadmill, immediately you have to make sure that person is not having any complications. Okay. Next is before the procedure, what and all care has to be done. That is pre-procedure care. Okay. So before the procedure, commonly the person will be stopped with the beta adrenergic blockers. Okay. These beta blockers are most of the time are stopped or withheld at least 24 hours before the procedure, because they tend to reduce the heart rate. Okay. So that is why withhold the drugs, that is beta blockers. Okay. Like metoprolol, atenolol, okay, then propranolol, all these are the examples of beta blockers. Okay. So beta blocker drugs should be withheld or should not be taken at least 24 hours prior to the procedure. Next pre-procedure care is, tell the person not to take a heavy meal before the procedure. You know, if you take a heavy meal, you can never go for exercise, isn't it? So tell them to have something light, and tell them not to participate in very heavy exercise or strenuous exercise before coming for stress test. Suppose before coming for stress test, they came by walking 2-3 kilometers or they came by cycling 2-3 kilometers. What happens? They are already tired, and then again you are giving the stress test. You will not get the absolute correct reading. Okay. So that is why tell them not to participate any strenuous activities at least 3 to 4 hours before the procedure. Next is, tell the patient not to drink any caffeinated beverages or not to smoke before the procedure. So not to take any sort of stimulants, whether it is alcohol, that also should be avoided before the procedure. Now, different types of stress test. Which are the different types of cardiac stress test? We have got 3 types. Okay, remember those. First one is master two-step climbing, bicycle ergometry, and treadmill test. Treadmill you are already knowing. That is already I showed you in the first figure. Okay, that machine is called treadmill. You are made to walk there. Bicycle ergometry means a stationary cycle is there. You have to pedal that. Master's two-step climbing means there are steps in that. They have to walk on the step. Okay. So we'll see in detail what are those. First of all, master two-step climbing. So here what happens is the client is asked to walk up and down. Okay. They have to walk up and down on 2 steps. Those 2 steps are actually 9-inch far. Okay. Not very nearby. So the 2 steps are around 9-inch, and the patient will be asked to walk up and down the steps. Okay. And then during the procedure and before the procedure and after the procedure also, they will be monitoring or checking the vital signs of the patient. Okay. That is done in master's two-step climbing. Okay. Next is bicycle ergometry. In the figure here you can see this is a stationary bicycle. It doesn't move. Okay. But what you are doing here is before the procedure, during the procedure, and after the procedure, what you have to do, first you should check the vital signs, that is blood pressure. You should put on the chest leads and connect it to the ECG monitor and monitor the ECG. Okay. So continuously what you are doing, monitoring the BP and ECG of the person, and the person is asked to pedal the bicycle. Okay. And you will see what is ability of the heart to respond to the stress. Okay, when they are performing this exercise, that is bicycle ergometry. The third one is treadmill test. So already I have told you, showed you the figure here. So this is the figure. Okay, so this is sorry, this is actually bicycle ergometry. So the first figure we have got treadmill. So that is a treadmill test. Okay. So here you can see the person is on a treadmill. Okay. So what they will do here is, here also similarly, before the procedure also, during the procedure also, and after the procedure also, what they will do, they will put on the chest leads and connect to the ECG machine, and then other hand they will put on the BP cuff and they will keep on monitoring the BP also. And then what they will do, slowly the person will have to walk on the treadmill. You know, the treadmill will be having some motion, isn't it? Slowly what will happen is the speed of the treadmill will increase. Okay. And the angle of the treadmill will increase. So when it becomes like this, initially it is straight, slowly once it is inclined, the angle will change. What will happen, the ability to walk will become more and more difficult for the person. isn't it? So initially it may be straight. Slowly, when the angle changes, it will become like you're walking on a steep hill. Okay, so what happens? The energy you put, the force you put will be different. Okay, so during that time also they're monitoring the vital signs of the person and ECG is recorded. So that is called treadmill test. Person will be made to walk on a treadmill. Slowly it will be inclined, that is tilted upwards. It becomes as very difficult, like the person will have to walk on a uphill. Okay, so that time you are monitoring the vital signs of the patient. So if they have got any changes in the vital signs, and if there is lot of complaint of the patient, like pallor is there, or chest pain is there, or dizziness, okay, or they are feeling palpitations, all that is there, immediately you will have to stop the procedure. Next is now moving on to the general instructions of stress test. First of all, you have to prepare the patient. So some things already I told, like how you have to prepare, isn't it? Withholding certain beta blockers, those things and all you have to tell. Then not to take caffeine, tea, or any other beverages which will stimulate the person, not to take alcohol, not to smoke before the procedure, that and all should be told. Then explain the procedure well, like you have to tell them how they will be made to walk, then the vital signs will be monitored, all that has to be explained. Then take the consent from the patient and the patient party. Okay, and tell the person to take adequate rest, not to go for exercise for a long period of time, and not to take a very heavy meal before the procedure. Okay, at least 3 to 4 hours before they come, they have to have a very light snack, or before 3 hours they can have the food and come. Okay, so that has to be advised for the person. Then tell them to wear loose clothes and come. Okay, and if it is a male client and lot of hair is there on the chest, you can shave the hair or trim the hair. Then most of the time during the procedure you should keep all the articles ready for emergency. Now sometimes what happens is, suddenly when you are doing this procedure, they can get chest pain or they can get heart attack or any other symptoms. So you should be prepared well in advance for the emergencies. So keep all the crash cart articles, that is emergency trolley, what and all articles are there, keep it ready. Like resuscitation devices, ambu bag, or maybe oxygen, okay, suctioning materials or emergency drugs, all that has to be kept ready. Next is, you have to see that after the procedure adequate rest is given. Don't tell the patient immediately after the procedure to go back home. They, on the way there to their home, they may develop chest pain and palpitations or any other signs and symptoms. So at least observe the patient for some time, okay, and tell them to report any symptoms within 24 hours. Okay, then one more important thing is, already I told, before the procedure, during the procedure, after the procedure, they are monitoring everything, that is your BP, ECG, and oxygen saturation and heart rate will be monitored continuously. So if there are changes in any of these vital signs, severe changes are there, that time what you will do is, you will have to particularly stop the procedure. So that is regarding the exercise stress test. Next procedure, which procedure do you think this is? Which is this diagnostic procedure? Can you see this? You can see that there is a monitor, screen is there like fluoroscope, and you can see that there is a transducer. The patient is checking something, isn't it? So it is actually a echocardiogram. Echocardiogram or echocardiography. You may think that it is ultrasound. Of course it is ultrasound of the heart. Okay, the simplest definition of echocardiography is, it is the ultrasound of the heart, that is recording the mechanical activity of the heart. Please remember, if you cannot remember the definition of echocardiogram, at least write down that it is the ultrasound of the heart, or it is recording the mechanical activity of the heart. Okay, that is echocardiogram or echocardiography. Now ECG means what? Electrocardiogram or electrocardiography. ECG is recording the electrical activity of the heart. So don't get confused. Echocardiogram or echocardiography is recording the mechanical activity of the heart. Okay, so it is a diagnostic procedure that is done to visualize the heart and the structures of the heart, and also to record the activity of the heart muscles and the heart valve. Okay, so that is echocardiography. You're using the machine that is a echocardiogram. So one screen will be there in which you can see the image of the heart, and here you are placing the transducer. Okay, you will put the jelly, same like ultrasound. You will put the jelly on the transducer and you will put it on the patient's heart. And then what you will do, you will move around. You can see the changes, like you can assess the blood flow, blood circulation, and the changes in the valve, cardiac muscle. All this can be seen in the echocardiogram. So definition, it is a diagnostic tool, that is ultrasound of the heart is called as echocardiogram. Next is moving on to certain other advantages of echocardiogram. It is a non-invasive procedure. Echocardiogram is a painless procedure. It is also very much comfortable compared to the other procedures. The time taken is only around 15 minutes to 20 minutes. Ultrasound will not take long. There are no particular contraindications, so that is a good thing, isn't it? Next is, it is very highly reliable. If the person who is doing the scanning is knowing to read it well, then it is quite reliable. Okay, and much preparation is also not required before the procedure. You need not do some emergency pre-procedure things. Okay, immediately if you need to do echocardiogram, shift them to the ultrasound machine, ultrasound room. Okay, then one more important thing is, tell the patient to remain still while they are doing the ultrasound of the heart. Next is purposes or indications. Now, what are the purposes? First of all, you need to assess the heart chamber. Okay, you need to assess the heart chambers, or you need to see the ventricular functioning. You will perform the echocardiogram. It is also done to detect any congenital anomalies, like in this newborns and all. There are a lot of problems, like there can be atrial septal defect, tetralogy of Fallot, ventricular septal defect. Any anomaly is there, you can detect it through this echocardiogram, because you can see the blood circulation, how is the normal circulation, what happens in abnormal circulation, all that can be detected in echocardiogram. Next is, echocardiogram also helps to know the valve functioning. Not only the normal valve, if you have put the artificial valve, that also can be easily seen through the echocardiogram. Next, it also helps to know about the pericardium, whether there is excess of air or excess of fluid is there. That all things can be seen in a echocardiogram. You can also see the structure of heart, you can see the valves, you can see the thickness of the ventricles. Okay, you can see all the this aorta, ascending aorta, the blood circulation, and also you can see the ejection fraction, or the cardiac output also can be detected. Okay, so particularly during the procedure, what you are doing, you will ask a person to stay in a supine position. Okay, tell them to sleep in a supine position straight. They should not move. Okay, tell them to relax. Then you will take the transducer and put it on the, you will put the jelly to the transducer and put it over the chest. Okay, so here you can see the figure of the echocardiogram. Okay, so once you are doing the procedure, you can tell that the person will feel slightly some sensation as you are moving the transducer. They will feel some sensations on the chest. So this is a transducer. Okay, so this is a transducer. So this you are putting the jelly over it, and then you will place it on the chest. Okay. Now next is, what is the principle behind the echocardiogram? Anyone asks you, you have to tell it is based on the principle of ultrasound. Okay, ultrasound, what is the principle behind ultrasound? It is based on the principle of sound waves. Okay, high frequency sound waves. Okay, so I'll show it, I'll explain in this figure. Okay, so what happens is, usually you will be having a transducer. I already showed you the figure of transducer. So transducer will be placed on the chest. Okay, it will emit high frequency sound waves. Transducer will emit high frequency sound waves. Okay, and this sound waves is sent through the body, okay, to the object, that is maybe to the heart. Okay, so sound waves travel to the heart here, and then it will reflect back. Okay, it will reflect back the echoes. These echoes are again caught caught up back, and then it will be seen through the TV screen. Okay, then that will be seen through a TV screen like this. So what they will do, initially high frequency sound waves are traveling to the heart, and then it will return back or it will echo back. Okay, that echoes are displayed in the form of pictures. So just remember, echocardiogram principle is behind the ultrasonic waves, high frequency sound waves. Okay. Next is stress echocardiogram. Now stress echocardiogram, in this what you are doing is, you are giving some exercise to the person. That is, you will give some amount of stress to the person, like maybe they have to walk on the treadmill or they have to walk on a stationary bike. Okay, and then they will monitor the BP, heart rate, and then they may also take a echocardiogram. Okay, that is, ultrasound images will be taken after the exercise. That is called as stress echocardiogram. Remember that. Only they will be, mainly they are doing some exercise, then they are performing the echocardiogram. Okay, that is called as a stress echocardiogram. Next one is TTE. TTE means trans thoracic echocardiogram. Okay, now trans thoracic echocardiogram is also a type of echocardiogram. What they are doing here is, still or moving image of the internal parts of the heart is detected using the ultrasound. Okay, transthoracic echocardiogram is a type of echocardiogram where a still or moving image of the internal part of the heart is recorded by the ultrasound, that is by echocardiogram. So what they will do is, a probe is placed on the chest or abdomen to get the various view of the heart. Okay, and this is also a bit of non-invasive, painless and highly accurate and a very quick procedure. And most of the time what they will be doing is, in trans thoracic echocardiogram, as I have told, here they will be most of the time doing the moving image. Okay, moving image is immediately noted in the transthoracic echocardiogram. Okay, so echocardiogram is having different types here. One is stress echocardiogram, one more is transthoracic echocardiogram. Okay, next is transesophageal echocardiogram. So as the name suggests, transesophageal means what they are doing, it is having echocardiogram also, and they are doing something like a endoscopic procedure also. Okay, so they will insert a catheter, through the mouth into the esophagus. Okay, which is attached to a ultrasound transducer, and then they will check the image of the heart. Okay, that you can see it through the screen. That is called as a transesophageal echocardiogram. Okay, I'll repeat. So as the name suggests here, echocardiogram is done, that is ultrasound of the heart is done how? By putting a catheter into the mouth, into the esophagus, and then it will check the heart. Okay, that is called as a transesophageal echocardiogram. It is also based on the same principle, based on the principle of sound waves. Okay. So in this transesophageal procedure, most of the time they can also inject a contrast media. Contrast media, you know, it is a dye in order to get a clear image. Okay, so here you can use a contrast media. Most of the time they will use a contrast media. And remember, they are putting a catheter into the esophagus. At the same time, that catheter is having a transducer inside. Okay, so that will give the reading, or that will check the blood circulation, or it will check any abnormalities. Okay, so that is particularly transesophageal echocardiogram. Now, what is the procedure before you have to do before the transesophageal echocardiogram? You should give the patient NPO. Why? Because you're putting a catheter through the mouth, isn't it? So, keep the patient NPO for 6 hours, remove any dentures, then slight sedation may be given. IV sedation is given to the person because they may be very anxious, and local anesthesia can be used. Then monitor the vital signs, oxygen saturation, then your blood pressure, ECG before the procedure and during the procedure also. Okay. And after the procedure, what happens is, because you're inserting a catheter through the mouth into the esophagus, the person may have some sore throat like appearance, or they may feel discomfort while eating or swallowing. That will return back after some time. Okay, so that is quite normal. Okay, so that is the transesophageal echocardiogram. Okay, it will usually give a very clear image to the patient.